Well, good morning, everybody, on this beautiful Wednesday. As I subtly and casually check my phone to make sure I get the date right, December 16th. On this Wednesday morning, we're happy to be coming to you live from the Real Talk studio in beautiful Edmonton, Alberta. Ryan Jesperson here, alongside our intrepid senior producer, Samuel G. Brooks.
Good morning.
How are you feeling this morning on this December? Does the divulgence? Although you're a details guy, you were if I would have walked in here and put you on the spot an hour ago and said, "Quick, what's the date?" Would you have said December 16th?
Yes, and mostly because I have to prep all the media for the show and I have to prep all the files, and I name everything with the date.
Okay.
So it's one of those.
It's
It's just it's so. It's so hardwired into me to just be, organizing things as per date I tend not to forget.
Are you set up already for the holiday? Like, assuming that your loved ones are not tuned in right now, assuming that we're not going to be giving anything away, are you prepared, or are you panicking now? 9 days, really 8 days from Christmas Eve, 9 days from Christmas. How well are you set up?
I'm trying not to count days because I'm just like, hey, Christmas is like sometime after next week.
Okay, so you're in trouble.
I'm not in trouble. I have a couple things I want to make, and I have all the materials like stacked up, ready to go in my garage, and I have gifts for the people in my sort of immediate surrounding, picked out, ready to go. And then there's like sort of the wider breadth, and I kind of gave myself a bit of a mental pass. Like, I have some little things for my friends here and there.
Yeah,
it's not going to come before Christmas. It might come a few days afterwards. I'm okay with that.
So you are as our Latin American friends would say, you are muy tranquilo. You are muy tranquilo. Everything is going to work. But at the same time, I absolutely love you've got your own little Santa's workshop going on at your place. You're going to be making your gifts. And if I've seen friends at home, Samuel G. Brooks, you got to see this guy. Like, you might think like, he's a pretty good producer. Yeah, he is. And then you find out that he like ran all the audio and video in here. You go, he's pretty good at setting that stuff. And I go, yeah, he is. And then you find out, and then you see his woodworking as an example, and you go, what the hell's up with this guy? How did Jesperson find this guy? And I ask myself that every single day as well. It's unbelievable. A man of many talents. We're lucky to have you here, Sam.
Well, thank you very much.
See
that's very flattering.
See, even subtly, like, just to pull back the curtain for a second, he even subtly switches himself back on camera to receive the praise. Like, that's how good this guy is.
I need to get better at putting myself on camera. Like, I'm usually just focused into responding to whatever you say, and it's kind of in my peripheral. I mean, you can see this is the monitor where I see what the live view is. So
sometimes I'll remind you. Like, sometimes I'll say, I remember last week at one point I said, "Put yourself on camera to receive the praise." Put yourself on camera to receive the praise. We're so excited about today. So I want to let you know out of the gate. So there are interviews that are going to happen, and then there are interviews that might happen today. And you might say, well, are these guys panicking? We're not panicking. If they don't happen, that's fine. We've got a backup plan. Which, quite frankly, is to talk to Sam about his Christmas ideas and to get to our hashtag RealTalkRJ, which is how you can get in touch with the show in the YouTube comments as well. In all seriousness,
the worst
though,
backup plan.
No, it's a fantastic backup plan.
We'll be just fine.
Because we're going to be easing into, we're not ready to divulge yet our New Year's Eve morning plan, because there's still some planning that needs to go into it. But we've got some pretty cool shows coming up.
We tossed around some really fun ideas yesterday.
Really fun ideas.
Oh yeah, it's going to be fun.
It's going to be great. But we're not going to be like, if you're expecting, on December 23rd, 24th, which we are doing shows. We're doing shows the morning of the 31st. If you're expecting those to be pedal to the metal, banging on the table, political coverage, no. There's a good chance that our coffees will be a light cream color, if you know what I'm saying, on those mornings. There's a very good chance that the conversation will be lazy and meandering, but still wildly entertaining. So we're going to soon be shifting into a bit of a different vibe as we get closer to a Christmas season.
You talk about like cream color coffee. Have you tried yet? I gotta plug a product that I'm in love with right now. Have you tried Hanson's salted caramel liqueur?
Excuse me, Sam.
Oh, do you have a bottle here? As Jespo gets up to go over to the Real Talk bar in the corner of the room to grab his bottle of salted caramel.
So this is what you're telling the people.
This is what I'm telling the people about right here. Let's.
Do I have a bottle, he asks. All right, pal.
Yeah, I've been a little obsessed with this stuff lately. There's a freebie for you, Hanson Distillery. We love your stuff. This stuff is absolutely delicious.
First of all, it's never a freebie because now this is real talk, and so the real talk is now we expect a case of that shit. If we're showing it on, by the way, the Podboard, allow me a moment of immodesty for 1 second. The moment of immodesty, because we're super excited about this. The Podboard 100, which is like the Billboard Hot 100, the Podboard 100, by the way, is based, it's based out of Sweden.
Yeah, you talked to those guys on Zoom one day, and that was really cool.
They want to do an interview with Real Talk because they're trying to. So we had never met these guys before. I actually wasn't even sure where it was based out of. But the Podboard 100 started tracking Real Talk when we launched the podcast. And obviously because of you at home and the action on the Real Talk RJ hashtag and the number of downloads and subscribers that Real Talk saw early. We're saying early. We're still early. We've done fewer than 20 shows. But in the very early stages, you started to make a lot of noise, right? Because all of a sudden there's this podcast out of nowhere that has thousands of subscribers and is trending on Twitter. And they're going, what's up with this pod? So they reached out to us, so we connected with them in Sweden, of all places. Very cool stuff, and obviously you had to coordinate that. So we're talking to them at like 3 a.m. And anyway, so they explained to us what the deal is, and they track podcasts from around the world. You can follow them. They do their rankings. And this morning, they've announced again that Real Talk is back on top as Canada's most listened to daily podcast. Like, crazy, right? Number 1 in the country. And so they tweeted this morning, the bad thing about Real Talk with Ryan Jesperson, they said, is that we have to try to find fun ways of saying he's on top of the Podboard 100 charts again. Give it a rest. They say guests yesterday, Ann Castleman from The Walrus, Heidi Bergstrom, and then, of course, Dr. Mana Saleh, which was
a monster episode we had yesterday. Holy man.
Right? I kind of felt like, and then yesterday, if you joined us on our exclusive special, we're calling this a special broadcast opportunity. About 2 o'clock yesterday, just after 2 o'clock our time, Dr. Stephen Duckett joined us, 8 a.m. his time in Melbourne, Australia. You remember the former CEO of Alberta Health Services, the whole cookie incident? Well, he joined us yesterday. We're about to bring you some highlights of that interview. So a wild day with those 3 in the morning, right? With Anne and Heidi and Mana in the morning, and then Dr. Stephen Duckett in the afternoon. And I think you and I were both pretty excited about that. So that's what's been going on around here lately. Why don't we, before we get started, I mean, we haven't even officially started the show yet because the show doesn't start until the opener.
This is the cold open still. This turned into might be our longest cold open.
Yeah, well, I think yesterday's was like 12 minutes.
Yeah, probably.
We're enjoying ourselves. We're having a good time, and we hope that you are too on this Wednesday morning. The cold open doesn't start until we recognize our hot presenting sponsor. What? Bitcoin Well. We're super excited that Bitcoin Well joined us right out of the gates. We met with them before the show launched, and they asked about sponsorship packages, and they said, yeah. But what's the title sponsorship package? Because they wanted to be part of this. There's something happening at Bitcoin Well. It started modestly. People are talking about cryptocurrency and Bitcoin, and Adam O'Brien, he starts this company, and then the next thing you know, there was a lot of hard work in between, but the next thing you know, they've got like 40 employees, and they're set to go public. They're moving into new digs downtown because they've outgrown their old place on White Avenue, though you can still get in touch with them there for right now. Really interesting and exciting story. If you want to get on the Bitcoin train, if you're interested, or maybe you just want to learn more, you need somebody to kind of spell out and explain what Bitcoin's all about. Maybe you want some Bitcoin gift cards to stuff those stockings with, give them a shout. You can find all their information under the sponsors link at ryanjesperson.com.
Real Talk starts now. Here's Ryan Jesperson.
All right, so I've got a tweet coming my way that's saying, Jesperson, you told us about the guaranteed guests, and you never told us about the ones that might show, but you don't know. And you're right. I should announce. It might be bad luck, though, to announce a guest that we've not totally confirmed, but we told you yesterday. So we're going to bring you our Stephen Duckett interview, highlights of that in just a moment. Very much looking forward to talking to Dr. Trudo Lemmens out of the University of Toronto, the Faculty of Law. He's a professor of law and bioethics. He's an expert on medical assistance in dying. He's testified before major players in Canada. You know that this Bill C7 is in front of the Senate right now. Dr. Lemmens has written about that and is going to be kind enough to join us on the show in just about a half hour's time. So we're looking forward to that insight on obviously a very serious bit of subject matter. In the 9 o'clock or the 9:30 to 10 o'clock block is where it gets interesting. John Mark Earle, I believe his home is Peace River, but we'll clarify if and when we connect with him. This guy has been doing, and I don't know if he calls them this, but the polar bear swims. Sam, can you call up one of his photos? So we've got we've ripped a bunch of photos off his Instagram. We're excited about this. John Mark Earle, the guy's an absolute. Like, as a compliment, he's a lunatic. Like, as a total compliment. And every single morning, literally every morning, today is the 1-year anniversary. Every morning, he grabs, like, a chainsaw or an axe or whatever the situation calls for, and he takes a dive. He look at this guy. Every single morning he does this. And today is the 1-year anniversary. So John Mark has agreed to join us on the show, but here's the thing. Where he lives and where he dips, it's not always conducive to great reception. And so he's going to be checking in with us. If the signal's strong enough, he's going to take his dip live with us right here on Real Talk. So this is the message he sends me yesterday. So I'm trying to talk to the guy, and we're trying to coordinate the details, and he's doing an amazing job working with us. And he reaches out and he says, I'd like to do as much as I can from the water. Right? He says it's going to be a cold day here. He says, but I'll give it a try. He says with the water temp and the air temp, what we're expecting. And by the way, he does everything right here. Maybe I should have the caveat or the asterisk here that says, like, don't do this in the North Saskatchewan. Don't try this yourself if you don't know what you're doing. Don't be inspired by him. And kids, don't do this without talking to your parents. We've said all that. I believe we've absolved ourselves of any legal implication here. But he monitors air temp, water temp. He monitors the flow of the water, all these types of things, right? It is extremely dangerous. It could be worse. He says, so with the water temp, air temp, what we're expecting, if I wear a toque, he says, I should probably be able to talk to you for about 10 minutes before I start shivering too bad. He says, I checked the river out, and it seems to be frozen enough that I can probably stay protected from the ice chunks that will be moving through. So it just, to me, that was a bit of a reality check as to the type of conditions that John Mark Earle deals with. So hopefully, if the signal's strong enough, he'll be joining us live and taking the plunge live on Real Talk coming up around 9:30 today. We're also expecting, and the only reason why this may not work out is because she this morning has her weigh-in. But Edmonton-based 8-time world champion boxer Jelena Mrdjenovich tomorrow is defending her world title in Los Angeles. She's obviously down there now. Today's her weigh-in, and so she said to us, we asked her if she could talk to us in about an hour from now, around 9:45. She says the only reason would be if she's like a pound. You know how these fighters work, right? She says, I may have to drop weight. Fighters are on another level mentally and physically, so that it's not unusual for fighters to be dropping, like, and I'm not going to talk like I know what I'm talking about, but like, she might need to drop like a pound or 2 pounds in like 10 minutes or 15 minutes. They put on we'll ask her how she does it if she can join us, but you hear these stories of boxers wearing like garbage bags over, they cut a hole for the head. I'm suggesting all these really dangerous things here. These are what the experts and the pros do, friends, not what we do. But they'll create a situation where they're just going to sweat it out, and then they'll like ride an exercise bike in like a parka for an hour. It's totally wild.
Sounds like torture.
It's totally wild.
Like, it's just like, I cannot believe putting your body through that.
It's unbelievable. Yeah. She though is 8-time world champion, right? And a lot of people are saying that this fight that she's got coming up is Paola Torres that she's going to be fighting. Apparently, people like Jelena's chances, although I'm not sure. We'll see how she approaches it. So if the weigh-in goes well, and if she's free and clear, 8-time world champ boxer Jelena Mrdjenovich will join us in about an hour's time. Let's get to our conversation with Dr. Stephen Duckett. So here's the deal. Dr. Stephen Duckett, now in Australia, his country of origin, which is where he's back working as a senior health executive, is about more than the cookie incident. Right? He's about more than that. 10 years ago, can you tee up that video? We have that video, right, of the cookie incident. Do we still have it? So you'll probably remember this. It was 10 years ago, a couple of weeks ago. I think it was like November 20th, 2010 or something like that. Dr. Stephen Ducket, here he is. He's at the Matrix Hotel in downtown Edmonton. That's Laura Tupper, formerly a reporter at CTV Edmonton. There's obviously a ton of reporters there, and they're following Dr. Ducket out, and they want comment about there was a crisis in Alberta's emergency care. And there was a lot of sniping back and forth between Alberta Health Services and the politicians. And Dr. Ducket claimed after this occurred that he had been ordered by the Premier's office to reserve comment on what had happened behind closed doors in that emergency meeting at the Matrix Hotel. Well, reporters knew that he was there. Reporters knew there was a meeting. Kudos to the camera operators that were able to keep this steady shot for about 2 minutes.
Something that only people like me that have operated cameras
Well,
notice
and
is
me too, pal.
the. Did you notice him click the ND filter on as soon as he walked out the window or out the door?
And switched, I would assume, to either a preset or auto white balance as well to go from indoor light to outdoor. See,
it's hard to do.
We're nerding out here, but that camera operator deserves a huge amount of credit for this steady shot, we'd call it. So Dr. Ducket was refused, and there you have it. Reporters from the Globe, the Journal. These are, there's Briar Stewart from the CBC. The point is that everybody's cameras were rolling on this as Dr. Ducket was refusing to grant an interview. And he was saying, I want to eat my cookie, right? I want a cookie. He said it like a few times. And he got, first of all, totally lambasted for it. Second of all, he got fired for it. He was canned 5 days later, lost his job as CEO of Alberta Health Services. It's not quite $1 million a year job, but it's close. Like the CEO of Alberta Health Services, I think the previous one made something like $700-800 grand. It's like you're on the sunshine list. Put it that way.
I think it was around $650 when he was
something
there.
like that.
Yeah, because I remember the news reports. Yeah,
but then with these high-ranking executive officials, there's always like the and you get this, and and you get that. And anyway, the fact of the matter is, everybody remembers Stephen Ducket for that. Stephen Ducket is also, quite frankly, a very charming fellow and good at his job. Like he went to the School of Public Health after that and then went back to Australia. And now he's been doing a lot of work at a think tank, coordinating a lot of Australia's efforts, or at least commenting and working with government on policy to ensure that Australia does a pretty good job when it comes to COVID-19. Adjusted for population, Canada, with about 37.5 million people, Australia about 25. The numbers, our numbers dwarf theirs in the wrong direction, right? To give you a sense, Alberta has seen 28,000 COVID-19 cases. Australia has seen 28,000. Canada has seen 473,000, right? Australia, 908 Australians have died from COVID-19. 13,627 Canadians have died. So what's the difference? We were curious. We wanted to know what's the difference in perspective. How has Australia approached this versus Canada? And yeah, of course, we did want to ask about the cookie incident 10 years later. So we connected with Dr. Stephen Ducket yesterday, and we wanted to bring you some of that interview. We wanted to bring you a portion of it. And so here's how the interview starts. We ask him how he's doing. We ask him about the outlook, and he just, as Alberta's locking down, nobody's going to be able to see their family for the holidays. You don't get to see grandma. Grandma doesn't get to see her new grandson. You don't get to see your parents. Here's what it's like in Australia.
So, Ryan, I don't want to gloat and rub it all into you, but I had 14 people for dinner at my house last night.
Wow.
40. And we cooked Atlantic salmon, as a matter of fact. But that's what we can do now. We have eliminated the virus from community transmission of the virus from Melbourne, where I live. There are still some cases in hotel quarantine. So we have arrivals into Melbourne now, and the people are isolated for 2 weeks. But for the rest of us, life is returning to normal. I don't have to wear a mask outside anymore, for example. I'm not restricted in my movements anymore, essentially. I go to a restaurant and they can't accommodate as many people as they used to because of density limits. And so we had a lockdown that lasted 110 days here in Melbourne. The government stuffed up the hotel quarantine program, and virus got out into the community, and that was, the community was essentially really angry about that. But then the government said, we are going to try and tackle this. We're going to get rid of this virus. And they did. And we lasted for 110 days, very strong community support. The Premier was in front of the media every day at 11 o'clock in the morning, telling how many cases that day, how many deaths that day, and there might have been a little snippet of news of some kind, but basically building support, building community support. During that lockdown period, I was allowed outside for exercise 1 hour a day. Only one of us could go shopping. I could go to medical appointments, but more or less but more or less everything else was closed, and takeaway delivery of meals and so on. So it was pretty tough lockdown, pretty long, 110 days, when the targets were pretty clear. We had to be, there could be easing of some restrictions if the 14-day average got below a certain amount, and then when it got to zero, basically major lifting of restrictions. And so everybody was actually focused on this number when we could have more freedom. And the day the Premier announced the number we could have lifting restrictions. Cars were tooting their horns, flashing their lights, and just lovely.
So a 110-day lockdown that obviously meant that Dr. Stephen Duckett had 14 people over for Atlantic salmon the other night. It's hard to imagine. We asked them about the vaccination plan and how do you maintain the trend. I mean, COVID has this nasty habit, as pandemics do, of resurfacing, right? I mean, in Alberta, actually, we thought we were doing pretty good, didn't we? Back in when the NHL bubble was here in our town, we were taking a look at the numbers. Everybody's going personal responsibility is working, and then whammo, there it is back again. So how are they going to prevent that? What's their vaccination strategy? How are they approaching it down under?
5 million people in Australia. It's going to take, even if everybody desperately wanted to be vaccinated tomorrow, it's just going to take a long time to manufacture the vaccine and to roll it out across the whole country. So there's a logistic exercise which will take a while to roll out. Some of the vaccines, we know you've got to be cautious about people with asthma, for example. So we're not going to get 100% of the people vaccinated on the 1st of March, for example. So it's going to be a slow process, even with the best management and logistics in the world. Secondly, the vaccines don't have 100% efficacy, and so there's always going to be risks associated with that. And of course, we've got people who may not want to be vaccinated for some reason. So, so getting to herd immunity may be a bit tricky. And so we're going to have to watch ourselves and monitor carefully all the time. And that means we still have people coming into the country. We still have quarantine, and there can be breaches of there will be breaches of quarantine. These are human systems, and so things will go wrong. So we've got to have both passive monitoring through sewage monitoring. We've got to have testing continuing. The rate of testing has declined a lot in Australia at the moment. It was up to, in this state, which is roughly the same population in Alberta, about 15,000 tests a day. It's now down to about 5,000 tests a day. So we've backslid a bit there. So we've got to keep our vigilance.
We got to keep our vigilance. So that's the reality there. By the way, the first Albertan to receive the vaccine, a respiratory therapist yesterday at the University of Alberta. We believe tomorrow we may be speaking with a respiratory therapist that's received the vaccine. But again, this is something I never used to do on the previous show, is talk a lot about interviews we're hoping to get. Because if you never get them, then people kind of go, well, it's easy to talk big game about the interviews you think you're going to get. Show us the interviews you do get. We're expecting that conversation tomorrow. I don't know what you expect when you talk to somebody about it, when you interview someone about receiving the vaccine. Obviously, the line of question, what was it like to be first? Did you have any hesitations? Why are you doing this interview? What are you hoping that people realize? What are you hoping that people think about? But really, there's not. So how was it? I mean, it was, it was what it was. Not a big deal. It's kind of, it is what it is. I mean, that's kind of
like every other vaccine I've received. It was like a little poke in the arm, and then it's done.
It's like every other. Have you seen the video? We should get this video. The video of the doctor. I think he's down in the States. That's like vaccinating the little baby, and he's like singing and dancing, and the needle. And he first of all, he has like a stuffy in his hand. He doesn't like have the needle waving at the kid. He's like got a stuffy. And the little baby's like cooing and like cuckoo. And then the doctor like slides out the stuff. He picks up and he sings and sings and boom, vaccinates and out. And then he keeps singing. And the kid's like, I'll find the video. The kid's like 6 months old, probably just sitting there and smiling through the whole thing. I was like, that guy.
That's fantastic.
That guy needs to be vaccinating everybody. So, of course, we asked Dr. Duckett about the cookie incident, right? 10 years later, where's your head at with regards to what happened, right? You walk out of this meeting, you wave a cookie in Laura Tupper, the reporter's face, you sort of snidely walk past everybody, you refuse to do the interview. 10 years, you get canned, right? You lose a fabulous job, although it comes with a lot of public criticism, but still pretty fabulous. So 10 years after the fact, where's your head at? And to be honest, Dr. Duckett was delightful through the interview. He was candid. He was fun. So I wasn't expecting him to kind of morph into, but I wasn't expecting how he answered the question. 10 years later, where's your head at?
Yeah, I made a mistake. So, yeah, that's life. As it turned out, there it is. I should have had a different way of saying no. As you said, I was instructed by the Premier's office not to make any comment whatsoever. We'd organised for another colleague of mine to comment to the media, and I should have been a bit better at telling the media I'm not going to comment.
Yeah.
So I made a mistake.
Yeah. He says, I made a mistake. I should have done a better job of saying no. I made a mistake. And I'm sitting there yesterday, and I'm thinking, can you imagine if me, and don't get defensive, but you, but maybe you're one of these people that always does everything right. Maybe I know a few of these people, calm, measured. They just handle everything, take everything in stride. They never say things they regret. That's not me. I'm a bit of if you know me, I'm passionate. My highs are high, my lows are low. If I'm pissed, I'm pissed. If I'm thrilled, I am thrilled. And then I've had to learn over the years to walk back things I've said, and I've had to learn to apologize, and I've had to learn to not hurt the people that I love the most, and I've had to learn humility. And some of you will say, well, you're still keep working on that, Jespo. Dr. Duckett yesterday, I made a mistake. Can you imagine if more executives, more public people, can you imagine if more politicians could look you in the eye by way of a camera lens and say, I screwed up. I should have done better. And I will do better. It just sucks the oxygen out of some room, and I just yesterday... I was expecting some big, long answer about what. And no, he goes, I made a mistake. Something to think about today. That was Dr. Stephen Duckett with us yesterday. We're going to talk to Professor Trudo Lemmens out of the University of Toronto's Faculty of Law coming up in a few moments. We'll talk about medical assistance in dying, Bill C7. The Senate, a lot of people are expecting that this is going to be sent back to MPs with some pretty big changes. And we're going to find out why Professor Lemmens is concerned, if he's concerned. And if so, why? First, let's say a big thank you right now to the team at Sherwood and St. Albert Dodge. We're really excited I've been telling you this because they deserve the credit. We like to recognize people when they deserve it. St. Albert and Sherwood Dodge has been on board as a sponsor of Real Talk before Real Talk was taking sponsors. That's how much we value this partnership. And it, in big part, is because I can say to you right now, if you're looking for Alberta's best selection of Jeeps, if Jeep is your thing, if you keep seeing what this brand is doing with regards to, those Wranglers are unbelievable. Everybody's excited about these Grand Wagoneers coming out next year. Maybe you want to get your hands on a Grand Cherokee like I'm driving right now. There's no better selection and no better service by far in Alberta than St. Albert Dodge and Sherwood Dodge. So go see Scott and his team there if you're looking to upgrade your ride in time for another big dump of snow, which may be coming as early as today, depending on where in Western Canada you're tuned in from right now. Out east, I think I can say, we're growing, we're watching our web hits and our subscriber base rising in Ontario day by day. I'm confident in saying I think Sherwood or St. Albert Dodge would be more than happy to ship one out there for you. I haven't checked with them on this, but I suspect that they would welcome your business in Eastern Canada.
Oh, undoubtedly.
Why wouldn't they?
You can just put a car on a train and send it over there, right?
Yeah, you
That's
can
how
do
it
that.
works.
That's simple. Or if nothing else, you and I will drive it out there for them, and we'll just do
I like that
we'll
idea.
do episodes of Real Talk on the way. We'll do the Real Talk road trip.
I'm going to have to go talk to them at Sherwood Dodge. I was just thinking.
The Real Talk road trip.
Hmm.
We'll just take that seed and plant it.
It's like we might have talked about this before.
Well, hey, let's not pull back the curtain too far. Let's not tell everybody that we're planning on wrapping a tour bus and going from Victoria to Prince Edward Island next year. Let's not tell that to everybody before we're ready, Sam. We're going to be known for announcing things way too early. This is what we're going to be known for. Okay, back on track. Friesen Brothers, right now. They've got 14 Alberta locations, but they're soon to open their 15th just off the Anthony Henday Rabbit Hill Road right here in Edmonton. The store is going to blow your mind, and I can say that because I have walked the halls. With proper PPE, they're doing the finishing construction in there right now. It looks incredible. Like I said earlier, this is not from Friesen Brothers. They did not ask me to say this, but if I owned another grocery store in South Edmonton, I'd enjoy it while it lasts. That's all I'm saying. If you own another grocery store, enjoy the customers while they last, because Friesen Brothers is about to take them all. Probably in part because they've got Red Seal chefs that can hook you up if you don't feel like doing the work. You want the turkey, you want everything prepped. This holiday season, Friesen Brothers has you covered. All right, before we get to Professor Lemmens, let's take a look at the headlines, Sam. All right, because I'm keeping it real, I'm going to tell you what I just did. I closed my headlines window, and it was not saved, which means I no longer have my headlines in front of me, but that's totally fine. Because off the top of my head, basically, we know that yesterday a respiratory therapist was the first in Alberta to receive a vaccination out of the University of Alberta. University of Alberta Hospital. It was Sarah Kahie who says, I felt honored and grateful to be part of the entire experience. Said when I woke up this morning, I wasn't expecting to be the first person in Alberta to get the injection. Says it felt like an historic moment. Said it was like getting any other shot, but unlike when she gets the flu vaccine, she did not feel any heaviness, numbness, or pain in her arm. And because my rewritten headlines are gone, I'll credit Lauren Boothby and Anna Junker from the Edmonton Journal. I'm reading their report here. Also, this Canadian, high-profile Canadian, for all the wrong reasons, arrested yesterday, Peter Nygaard, a Canadian fashion designer, now being held in a Winnipeg jail. He's being charged with several counts of sex trafficking and other charges. His lawyer insists that he's innocent. The charges date back, in some cases, decades, and more recently, a number of different countries where it is alleged that Mr. Nygaard trafficked sex workers, in some cases utilizing drugs to have those human beings submit to his wishes, as one of the warrants read yesterday. That's Peter Nygaard, and we'll follow that story as it develops. Yeesh. That's, I don't know if you've been following that Peter Nygaard story, though, but there was talk about that a long time, even through the
there was a whole Fifth
movement.
Estate series on him too, right?
Yeah. This was kind of one of those stories where people are like, what about that guy? Like, when's that guy getting arrested? And he had always maintained, and to this date still maintains, his innocence. I think he's in his 80s now, Peter Nygaard is. As mentioned, being held in the Winnipeg jail, and you expect he'll be extradited. All right. Are we set to go with Professor Lemmens?
Not quite yet.
Okay.
You need another headline? I've got one.
Yeah. Okay,
sure. Can I break some news?
Absolutely.
All right. CBC reporting literally half an hour ago, Canada's sending an astronaut to the moon.
Oh, this is that Lunar Gateway mission.
Yeah, so they're establishing. I guess the U.S. is establishing a base on the moon around 2023 that they're going to use for experimentation on a future manned trip to Mars, and they've signed an agreement with Canada that there will be a Canadian in the mission to the moon in 2023.
Very cool. So I wonder if that means if you're part of the mission to the moon. I'm not trying to be a jerk here. I'm just making a point. Everybody knows the name Neil Armstrong. And then most people, I mean, everybody kind of knows the name Buzz Aldrin, right? Buzz is kind of the wild. Buzz is like, have you seen the video where some guy walks up to Buzz Aldrin at some event he was at, and he basically says that the moon landing was, he's like, you're a liar. Buzz Aldrin at the time, I think that this happened, was like 70 years old. Here's what we need. Here's why we need like 200 more of you to sign up for our Patreon. Because if you go to ryanjesperson.com and commit like $5 a month just to show us that you want to join this journey, if about 200 more of you did that, we what we'll do is we'll get a chase producer that will join us here in studio, and they can call up these videos in real time. Because right now Sam's got his hands full, and I'm running my mouth. And basically, we could get these videos for you in real time. But this guy walks up to Buzz Aldrin, and he's like, "You're a liar. The moon landing was fake." And Aldrin just, bam, like right in the nose. Like if kids are watching right now, that's not how we want to conduct ourselves. But it was great. Like it was one of these situations where it's like, you encounter these folks. I used to have to be careful about saying stuff like this on the radio because it would bring the crazies out of the deep corners of the carpet. But it's like, the people about like chemtrails or like, 5G, Pizzagate, like these sort of, the moon landing is fake, like all this type of stuff. And you're like, I'm not getting into it. And then sometimes you'll engage and be like, well, actually, the moon landing, actually, if you pay, Buzz Aldrin doesn't have time for that. He did not have time for this guy, and he smoked him right in the mouth. But the point is to say, you've got Neil Armstrong, you've got Buzz Aldrin, but what was the name of the fella that stayed on the spacecraft the whole time?
Is this a trivia question? Because I actually don't know. I at one time remembered the 3 crew members of the Apollo 11 mission, and I don't have it off the top of my head.
I'm taking a look here at our live chat. Greg Wolfton's watching. He says, we need Buzz Aldrin at the anti-mask rallies. Yeah. Now someone's going to say, use the hashtag, Jesperson and Sam are advocating for punching anti-maskers in the nose. No, we're not.
Michael Collins was the 3rd astronaut on the Apollo 11 crew.
Okay, so there you have it, Michael Collins. So, so you wonder if the Canadian, like, are they going to be walking on the moon? It says they're going to orbit the moon, right? David St. Jacques is the Canadian astronaut, will orbit the moon, which, okay. Are we going to wax? Let me know when Professor Lemmens is here.
Oh, he's good to go.
Oh, well, geez, what am I doing talking about Apollo 11?
To be fair,
landing?
In the middle of moon talk is when he logged in. So,
okay.
It's.
I'm like, well, good thing I didn't start going off on a tangent about where I would like to see space travel go, because right now, like, they're orbiting the moon. Okay, fine, but like, didn't we do that in the 60s? Anyway, I don't even know what I'm talking about, so don't listen to me. But aren't we supposed to be? We're supposed to be orbiting like other galaxies now, aren't we? Or aren't we supposed to be able to go on like our summer vacation to Mars by now? What's going on? What's with the holdup? Let's go. Let's get serious. No, actually, this is serious, and I'm not, this is what we would call a hard transition. Right now in Canada, there's a lot of talk around medical assistance in dying. It's been about 4 years since options were opened for people living in chronic pain with chronic disease. There were obviously a number of criteria. We'll get into this with our expert guest. If you wanted to consider medical assistance in dying, some people call it dying with dignity. 4 years ago, Canadian legislation changed to allow for it. Well, right now, the Canadian Senate is taking a look at Bill C7, and it's raising some concerns, and some are suggesting that this may need to be walked back, as senators are likely to propose major amendments to the assisted dying bill. Somebody keeping a keen eye on this is Professor Trudo Lemmens. He's the Scholl Chair in Health Law and Policy at the Faculty of Law, the Joint Center for Bioethics, and the Dalla Lana School of Public Health at the University of Toronto. Professor Lemmens was a member of the Council of Canadian Academics. They call it the CCA, their expert panel on medical assistance in dying. He's an expert witness for the federal attorney general in Quebec's Truchon case, and he testified before Parliament on the current law as well as Bill C7. Professor, it is a great pleasure to have you join us on the show this morning. Welcome to Real Talk, and thank you for making time for us.
My pleasure.
When you take a look at Bill C7, and as we talk about now what the Canadian Senate is likely to send back to Parliament, Can you bring us up to speed on what's changing or what's proposed to be changed as opposed to what was legalized 4 years ago?
Yeah, so let's start with what was legalized. 4 years ago, we had a bill which responded to a Supreme Court case in Carter, which legalized medical assistance in dying, which contains two components or offers two options for medically assisted death at the end of life, namely physician-induced dying and physician-assisted suicide. So in other countries, this has been called, on the one hand, euthanasia, when the doctor, when it's doctor-induced dying, when it involves the prescription of medication that the patient takes, him or herself, it's assisted suicide. So these two have been lumped together in our system as under the term medical assistance in dying. The law, as it was introduced 4 years ago, restricted or basically focused this provision or this procedure to end-of-life circumstances broadly conceived. The law specifies that people can only have medical assistance in dying when their death is reasonably foreseeable, a very vague, lofty term, but it basically means the end-of-life context. Now, from the beginning, some people have objected to that. The advocacy group Dying with Dignity objected to that firmly. They argued that medical assistance in dying should be available much more broadly, even outside of the end-of-life context. And two people in Quebec and one person in BC went to court arguing that their death was not reasonably foreseeable or that they were not close to the end of their life, and they wanted to have the assurance that they could have access to the procedure. And a Quebec lower court agreed with that and argued that the restriction to reasonable foreseeable death or the end-of-life context was unconstitutional as a violation of the right to security of the person and right to liberty, and also discriminatory. And so the government introduced now Bill C7, which basically expands medical aid in dying outside of the end-of-life context, but also, and this is not required by the Truchon decision in Quebec, also abolishes certain safeguards that were deemed to be too burdensome for people who apply to medical assistance in dying.
This is, and it's interesting when any legislation goes to the Senate, because you have partisan senators, you have independent senators, and in this circumstance with C7, based on what I've been reading, there are senators that believe that it goes too far, the legislation, and some believe that it doesn't go far enough. Now, when we talk about a reasonably foreseeable death, why would it be important for somebody advocating against somebody fighting this legislation, somebody that does not want to see that removed? What would the argument be? I suppose it's a moral or ethical argument that this politician or this senator would believe that ethically it is inappropriate to grant someone access to a doctor-assisted death if their death is not reasonably foreseeable. I can see others arguing quite strongly that that's not the politician's decision. That should be the person's decision. Can you take us into where you land on that debate?
Yes. So I think there are a couple of positions on medical assistance in dying. There are people who think it should never be allowed because it transgresses basically a prohibition which exists, I must say, in most countries around the world, that physicians should not be involved in the direct ending of the life of their patients. There are other people who say, well, certainly based on the Carter decision as well, and based on the acceptance that for some people, controlling the manner and the timing of their death, the manner, namely having some physician assisting in ending the life in ending your life is important. So some people say we accept that for some people it's so important that the manner and timing of their death can be controlled, but it should be restricted to what it was originally certainly claimed for to be important, namely helping people to transition between life and death. So when they're close to the end of their life, suffering is intense, or they feel that basically the dragging on of the dying process is burdensome. So it should be available in those circumstances. And then there are people who are arguing, well, medical assistance in dying should be a form of therapy and should be available to people who feel that they're suffering intolerably and that nothing that society can offer, nothing that medicine can offer will satisfy them. So I belong to the camp of those who argue we have a bill in place. It allows already in a broad set of circumstances people to obtain medical assistance in dying. And so not just people who are in the dying process, but even people who are simply approaching death because of a chronic illness and because of the suffering associated with it. So I think this is why medical assistance in dying was originally claimed to be important. And this can arguably be seen as, well, a reasonable option when where medicine can provide support in the sense that people are in the dying process anyway, and they have no other medical options left, and it helps them to obtain a more peaceful death. When we go outside of the end-of-life context, we're basically suggesting that physicians should be involved in ending the life of people who may have years or decades of life. Importantly, also in Bill C7 that is currently proposed, there is no requirement, for example, that all other medical or social support options or all psychological options be exhausted. So in other words, patients can refuse the options that physicians, social workers, nurses can offer to the patient to help them relieve their suffering. And they can still say, well, I don't want to have anything that medicine normally provides to me, but you still have, as a physician and as a nurse or as a society basically support active ending of my life. So basically, you have to support me in my suicide. And that, I think, for many people is troublesome, particularly also because Bill C7 doesn't say just in general, everybody outside of the end of life should have access to this procedure. No, it says people who have a chronic illness or a disability, so only you, people with chronic illness and disability, indeed, rightly should claim that you should be able to have access to a medically assisted death. So people with disabilities and chronic illness are targeted, or basically send the message that we as a society understand and think it's appropriate that they, but only they, will have access to societal organized and medically provided death, even if when they have years or decades to live.
I hope that this is not a crass comparison, but when it comes to matters of ethics and law, that intersection, there are legislated options to people, and then there are options that people may seek out in most circumstances tragically and with great risk if legislation does not provide them options. And I can think of two, and I hesitate to group them together. But when you talk about medically assisted abortion, when you talk about medically assisted death or medically assisted suicide, which I know is not the preferred term, but I want to be clear I'm differentiating between the two here, you could quite rightfully suggest that if you don't have doctor-assisted abortion, women will find other ways to have an abortion. And in many circumstances, the physical trauma that they will undergo and the damage that could occur, and the lack of dignity for that matter, is significant. With medically assisted dying or medical assisted suicide, you can say the same thing. There are people, and there have been people through history, that are determined to leave their pain behind forever. So whether or not doctors are available to them, they will find a way to die. And I would suggest that would lack dignity. It would create potentially more problems and would be much more traumatic, and in some cases would involve family members putting themselves in a very difficult position. In other words, assisting their loved one without a doctor present.
I understand.
Is
I understand, but, yeah, I understand the comparison. I think the comparison is not right. There is often a comparison made with abortion. I actually think that a lot of rhetoric is used. Oh, if somebody has a problem with the broad expansion of medical assistance in dying as a form of therapy, they're anti-choice. Now, this is the kind of the rhetoric that is being used. I'm not saying you say that, but it's often used. Oh, if you're against medical assistance in dying, it's like the abortion rhetoric. I think the circumstances here are very different. We're talking about the person who many people who will survive if we have restrictions in place against or if we have prevention measures against suicide, if we make sure that all the measures in support of life are being provided, we will prevent people from dying. In the context of abortion, you're talking about the fact that we actually prohibit a practice which leads to women dying. You see how difficult the comparison really is, because here we're talking about the importance of trying to prevent that people die, and the importance of focusing on giving people a life with dignity. And so the concern that people have with an expanded system of medical assistance in dying is that people who will continue to live for years or decades will now be induced in ending their life prematurely. And I'll give you the concrete example. People with catastrophic illnesses, catastrophic accident, for example, who become paraplegic, we know from the evidence that the suicidal ideation, so the tendency to commit suicide among these people, is so much higher, up to 1-2 years after their accident. But eventually, they turn things around and they actually have the same quality of life. I mean, with the challenges that it obviously creates, but they have quality of life, they have meaningful lives. So I think the abortion comparison is only goes so far, because we're dealing there with the need to prevent women from dying in horrible abortions, backstreet abortions. Here we're talking about the need to preserve people's lives, the same people who actually may, because of the circumstances, be tempted to ask for medical assistance in dying because they don't have adequate social support, because they don't have disability support, because they don't have access to a normal treatment. I'll simply also mention this. It's for many people who are troubled by the expansion of the legislation outside of the end-of-life context. For us, it's remarkable that this is so heavily pushed as being a priority that we make sure that the federal government and the provincial governments, actually what the federal government imposes, coverage for medical assistance in dying across the country, but that we still don't have a universal pharmacare program, that we don't have coverage for often life-saving drugs outside of the hospital context. So there is something troubling in the priority that is being given here in this bill, and particularly also the speed by which this piece of legislation is being pushed forward in a with all its difficult components that we can't address here in all of its details. But I'm happy to answer any other questions about the challenges that we see here in this particular bill.
Well, yes, and I have many questions for you. We're talking to Professor Trudo Lemmens, a faculty of law professor, an expert in bioethics out of the University of Toronto. Professor, the conversation underway among our audience members is remarkable and insightful, and I really appreciate it. Turbo Annie is watching this morning on YouTube, and she's asking if we could discuss the application or the context of mental illness with regards to medical assistance in dying. Are you confident that Canadian legislation is adequate in the context of mental illness?
Well, here you're touching on one of the controversial components of the bill. The bill expands outside of the end-of-life context. Many people, including myself, think that the expansion and the focus on facilitating the death of people with disability and chronic illness is discriminatory towards them because it makes it easier for them. It deprives them of the protection that we normally see in the legislation, which is a protection of only offering MAID to the end-of-life context. But the bill also is controversial for other people because it excludes mental illness from the expansion of the law. Now, Minister Lametti has already indicated that this will be discussed in a further review of the legislation. He seems to be inclined indirectly that by the idea to think that the medical illness should be an option or should be a reason for which people could ask for access to medical assistance in dying. I support the exclusion of mental illness, but because I also support already the fact that it shouldn't go beyond the end-of-life context. Why am I concerned that there are specific reasons to exclude mental illness? Mental illness is complex for a number of reasons. In other forms of illness, we can clearly identify diagnoses are never 100% sure, but we can clearly identify there are measures to establish whether somebody is likely to get better or will likely be able to cope with the illness or will likely die in the near future. In the context of mental illness, there is fundamental uncertainty about the prognosis. Reliable tests to determine who will get better and who won't get better don't exist in the context of mental health. So we have there a difficulty that we will establish access, give people access who suffer from a very debilitating, very serious illness. And there's no doubt about that these illnesses do create enormous suffering, certainly as significant as physical suffering. But what we will be doing there, if we would offer medical illness and dying to people only on the basis of mental health, they have access actually already if they have another form of illness which qualifies under the bill. But if we offer that to people with mental illness, we're offering it to people of whom we don't actually know whether they will get better or not. And we know that the majority of people with mental illness with adequate mental health services will get better and will recover. Of those people who won't get better, we actually don't know who they are. We cannot predict in an individual basis if somebody will get better or not. So we're basically giving up on people in a very complex context also where mental illness is often associated with suicidal ideation, with a desire to die. So the desire to die is part of the reason, part of the illness that we're trying to treat, that we're trying to help people with. So we would offer here basically a remedy, which is the end of the person's life, a remedy for their suffering, where when they actually their desire to die is part of the illness that we're trying to fight.
You are without please go ahead.
Yeah, no. So I think in the context of mental illness, we know that there are very significant wait times in the country. We are struggling with the mental health services in the country. We have, in the context of the pandemic, already seen that there is increased anxiety, increased mental health challenges that people face. So I think it would be particularly unwise, even also for other illnesses, but it would be particularly unwise to start promoting more broadly access to life-ending measures when we really have to ramp up our support and make sure that people have access to a life with dignity and adequate support to get better.
Professor, I want to read some of the comments here. April says, my Baba opted to stop treatment and essentially ended her life through medical assistance. We were so blessed that she was able to make that decision herself. Another says, I appreciate, this is an interesting comment. Listener says, doctors, this is Mr. Cynic, says doctors take an oath to do no harm, but keeping someone alive when they are in constant, unrelenting pain is doing harm. Annie says if physicians don't assist, people will find a way to do it on their own, perhaps incriminating their friends. Sharon this morning says, I had a family member that utilized medical assistance in dying this year. She was able to make her choice and leave in dignity, but she had to go to a different room in the hospital that was set aside just for that. Jackie's listening in on Twitter. The hashtag RealTalkRJ says, my uncle in his 80s chose medical assistance in dying when his heart failure was to the point that treatment was no longer viable. He chose the terms. His sons were with him. My cousins said it was a peaceful death. Doctor, one thing, you haven't specifically identified palliative care, but you are making a strong argument for a better investment in palliative care, correct?
Yes, I would say our priority should always be, in my view, and the Charter of Rights and Freedoms that we frequently invoke actually obliges the state to provide protection in life. The right to life is an important value that is also protected through the Charter. So I would say, yes, for many people, medical assistance in dying is important, but let's make sure that we certainly have adequate support in place for dignity in life. And I would say from the comments that I heard, again, the people who are talking about the value of medical assistance in dying, that's currently possible within the current system that we have. What we're talking about is a very different situation. So we have to be careful that when people like me and others express concern about expansion of medical assistance in dying, that we're not lumping everything together as, people are against the relief of people suffering, or people are in favor of doctors artificially prolonging the life of patients. I would say absolutely not. So I want to simply put that out there in response to some of the valuable comments of the people who share their positive experiences with medical assistance in dying. But to come back to your point, yes, I strongly think that we need to make sure that we have access to all other medical options to relieve our suffering in the first place. And then, as the Supreme Court also emphasized in its Carter decision, medical assistance in dying is not just a standard form of therapy. It's basically, it really is a last resort when we don't have other options left. With respect to palliative care, it's interesting to mention that, yes, palliative care has been improving gradually over the last couple of years, last couple of decades, but still many people don't have access to adequate palliative care. Whether all of the people who apply for medical assistance in dying have access to palliative care, or at least had the option of palliative care, is still being debated. The Health Canada report on the 5,000 and so much deaths that we had, for example, in 2019, indicate that 80% of them had access to some form of palliative care. There are other reports in the medical literature now that suggest that the rate may actually be lower. We have to keep in mind that the data with respect to medical assistance in dying is self-reported. So whether it's 80 or 60% is another number that has been put forward. We still see that there are a significant number of people who don't have access to palliative care, or didn't have adequate palliative care provided prior to deciding on medical assistance in dying. So I think that can be improved. I would also say we want to make sure that we know sufficiently what is actually going on in the quite significant number of people who have obtained medical assistance in dying in the country. The data that we are receiving are not very deep data. So they say something about, there was some form of palliative care. What was the quality of that care? How much palliative care was being provided? When did that palliative care start? Was it months before? Was it a year before? Was it just days before? So the circumstances under which we currently already apply medical assistance in dying are not so clear. We need more data to understand what's happening.
Professor Trudo Lemmens obviously has an incredible depth of knowledge with regards to this, and we're so grateful that you've made the time to talk to us, Professor. If you're just tuning in, Professor and Scholl Chair in Health Law and Policy out of the Faculty of Law at the University of Toronto. Thank you so much for your time and insight today.
My pleasure. Have a nice day.
For those of you that are tuned in through this conversation, I want to let you know we're going to leave some time a little bit later on in our show to get to your comments. Thank you for the thoughtful exchange of ideas that we're seeing here. Obviously, this is a polarizing topic. Obviously, there will be differing opinions and much personal experience here, unfortunately, coming into play, and we appreciate what you're sharing with us by way of the Real Talk RJ hashtag on Twitter, and of course our live comment thread that's going on right now on YouTube. We're going to check in with a remarkable individual in just a moment, but very quickly we wanted to let you know how grateful we are to have the support of Clean Air Club each and every morning here in the Real Talk studio. We asked them to take a look at this studio space when we first got it and evaluate the air quality. We wanted to make sure that we could breathe easy. The more that we talked to them, and they gave us our own personal, customized solutions in here, they can do the same for you. And the big thing that they kept coming back to was furnace filters. They said, people just forget about it. Some people aren't even aware you got to change the filter. I mean, for some people, it could have been years already. It's got to be several times a year, but you want to talk to them, not me, about it. Here's the deal. You go to cleanairclub.ca, you sign up, and then basically they do the rest, including delivering the new filters to your front door, so you don't ever have to worry about it. Cleanairclub.ca, so you and your family can breathe easy. We're also so grateful to the team at Westworld Computers for keeping us on the air each and every morning. We've basically got the lineup here. I've got my iPhone, we got the iPad, we got the MacBook Pro and the iMac, and they're keeping us bringing you Real Talk each and every morning, just like they've done for so many businesses and so many households in Western Canada for more than 40 years. Family-owned, family-operated Westworld Computers wants your business, and we're grateful for theirs. You can find more under the Sponsors tab at ryanjesperson.com. All right. I'm so excited that this appears to be working out. John Mark Earle is a legendary human being, and you're about to see why. If you don't recognize the name, you're never going to forget it after these next 10 minutes or so. Let's bring him in live. Today is the 1-year anniversary, my understanding, of the very first time that John took a plunge, so to speak.
I'm going to bring him in right now. You're going to be able to hear him, but I'm still trying to get his video sorted out. He was on, and then he froze, and now it's looking very black. Well, so we're working on it.
It might be because he's in frigid temperatures, and my understanding is he's right on the ice. Sam, there's no rush. Just you just let us know when you're ready to bring him in the minute we've got video, and we'll welcome John to the show. Just bring his pot down for now. Yeah, there you go. Why don't we get to some of your comments here on the YouTube thread about what you heard from Professor Trudo Lemmens, and we'll get to John Mark Earle in just a moment. This I understand is a polarizing topic. Don is watching this morning. He says, a friend of mine in British Columbia with brain tumors has been on the list for medical assistance in dying for years. He's quickly deteriorating, and his 78-year-old mom is overwhelmed. Don says last time we spoke, he said that it may be time. Others of you writing in on your, I'm going to read this one. This is an interesting comment, kind of out of left field, but it represents. We want people to have a voice on this program. Your perspective is not, whether or not you feel like your perspective is of value on other radio programs. Maybe you've never heard your comments read, or maybe nobody seems to pay attention to what you have to say. Real Talk can be your home for that. And 2 Beaver is watching this morning and says, hey, if First Nations people want assisted death, we just call for a wellness check from the RCMP. How's that for something to talk about? Penny is watching this morning and says, I have a plan in place, and I have discussed it often with my children. It's documented in many places. Penny says, I will not allow a politician, my Conservative member of Parliament, to make these decisions for me. I'm grateful to know that our good friend Julie Rohr is watching the program this morning. You remember Julie was with us, our first week on the air, telling her remarkable story. Julie's one. I've said to Julie, in my opinion, her portrait needs to be painted as a mural on the side of a building in Edmonton, because there's something about her smile, her perspective, and I know it resonated with so many of you. Julie's fighting a very rare form of cancer. She has been for the last 5 years, and she tweets at us with the hashtag RealTalkRJ. She says, as someone who lives with ongoing disease and who has to think about my own mortality on a regular basis, I appreciate the discussions around medical assistance in dying. She says, thank you, Jespo, for having Trudo Lemmens to talk about Bill C7. This is an important discussion. Julie, thanks so much for tuning in, and we're always looking for your perspective on this show. Thanks very much. All right, it sounds like we've got John Mark Earle ready to go, audio, video, all lined up. Let's bring him in here. John, welcome to Real Talk, my man. I'm so excited that this is working out. Thanks for joining us.
Me too. Thank you so much for having me on here.
Okay, you are a wild animal, and that is a total compliment. Why don't you paint a picture for us of where you are and what you're about to do, and why is this morning so significant?
Well, it is minus 26 wind chill right now. It's been snowing here for days. I do have a little fire kindling in front of me, but I'm in a few minutes going to be going out into the river. It's been steadily freezing out further and further from the shore over the last few days. There's been some big ice flows going through. So it's been a steady increase of cold here, and we're just bracing ourselves for it.
John, are you in Peace River right now, or where are you exactly?
Yeah, I'm in Peace River, and just right on the side of the river across from the town.
Okay, so today is the 1-year anniversary, correct? If I understand, on the first time you did this, and have you literally logged 300? What do you call them? Polar bear swims, or whatever you call them? Have you logged 365 in a row?
No, I haven't.
Okay,
but when we set this meeting up, I didn't realize it was actually going to be on the day that I started last year, when it had started just as, 1 day, 2 days, 3 days, and then it grew into, hey, maybe I can do this for longer. And it really turned into something beyond even what I had imagined.
So why do you do it, man?
Yeah, I get asked that a lot. And it's because it's so enlivening. With everything that we do that creates improvement in our life, we have to face things that are difficult, whether that's doing diets, working out, making change in our life. And this is one of the most uncomfortable things that I do, and I really reap equivalent benefits in my life. And it's been such a joy for myself, and then to see other people participate and come get on board and find their own way to get involved with this.
Hey, John, I want to read a comment from Cindy, who's watching right now. How great of a compliment is this to you? She says, this is fucking crazy. I switched to the big screen for this. So Cindy's off her phone and she's switched to the big screen. So we're about to see you take a plunge. I feel like we should do just sort of like a bit of a sort of a small print here, just to divulge our, to sort of absolve ourselves of any liabilities. What do people need to know? What do you need to consider before you do something like this? What are some of the things that obviously are important to mention about what we're about to witness here?
Well, there's a big difference between doing an ice bath in your tub with some ice cubes and doing an ice bath in a situation like this where you're dealing with extreme temperatures. The wind is cold, the air is cold, and if I come out and I haven't taken the proper precautions, my skin will start to freeze at these temperatures. And I'm going in a spot right now that I have gone many times in the past. I know what the conditions are like. I know what to expect when I go into the water. And I would not encourage anybody to do this who feels even a bit of reluctance about their safety. It's something that this year we've had a few incidents already where people didn't take the right precautions. Not with me, but trying it on their own, and they ended up with some frostbite, and that'll really affect them, for the rest of this winter. So I would encourage anybody who's interested in this, try it, but try it with somebody who's done it before and in a place that you can do it safely.
Okay, so what are we about to see here, John? So you're going to take the plunge. I'm assuming you're not going to talk to us when you're in the water, or are you going to talk to it? Can I keep asking you questions when you're in the water, or no?
I'm going to bring you out with me into the water. I'm going to just need about 10 seconds here to get into my shorts.
Yeah.
And then I'm actually going to go out. My son is here with me. He's going to go in the water with me too.
Oh, wow. And then how long will you be in the water for?
Today, I think I'm only going to go in a couple of minutes.
A couple of minutes? Okay.
Yeah.
I was thinking 10 seconds, but okay, you're going to go a couple of minutes, and we'll talk to you in the water. And then when you get out of the water, you said you have a fire going. Will you come back to the fire?
Yeah, I'll come back to the fire, and you get to kind of see a little bit about how I finish my process here.
Okay, John, take it away. You have to say the least, you have a captive audience, and
okay.
this is
Just give me 1 second here.
yeah. That I mean, totally fine. You you do what you need to do, ladies and gentlemen. This is out of Peace River, Alberta. This is John Mark Earle. This is the 1 year anniversary of the first time that he did this ice bath. You have to follow him, by the way, on Instagram at John Mark Earle. The photographs, his wife takes remarkable photos, absolutely beautiful. This guy is an absolute Canadian legend, and his son going out with him today too. I wonder if if you're in John Mark's family, if you kind of feel like you get looped into this stuff, roped in, so to speak.
Okay. His son's bathrobe is the greatest thing that I've seen in a while.
Yeah.
That is fantastic.
So John Mark's going to take us out with him. How many of you are running ice baths at home right now to do this in solidarity with John Mark, I wonder? I think we could probably count it on one hand. Most of us are in pretty comfortable situations right now.
We're getting a lot of cringy comments on the YouTube right now. Yeah, good God.
Yeah. People are cheering for you.
Okay, I'm here with Jeremiah. This is my son. And Jeremiah is the one who had initially challenged me to go in the water 2 years ago. So he is going to come out with me today. I was here last night, and even since last night, the river has frozen out probably another 15 or 20 feet. And so I don't know if you can see, but the walk out, I had to come in. I broke a little path so that I could get out to the river. Jeremiah and I are just walking out right now in our bare feet. Oh, but it's just about like you would expect it to be.
Yeah. Minus 26 wind chill. Yeah, I can imagine.
I'm just going to show you a little bit about what we're walking through right now.
Oh, jeez.
This is where we had to break it out.
So John Mark, you've busted this out with what, an axe to this point, or a shovel?
I walked out in my rubber boots and I broke as much as I could. And then I was able to break the rest with an axe and push kind of some of the bigger chunks out. But so I broke this ice maybe 15 minutes ago, and there's already a little layer that's on the top. So we're out as far as we're going to go here now. We're just going to get down in. I've never done this before with a microphone, so so you can see behind us, that's the town of Peace River. So what happens when you come into the water is your body goes into pretty intense reaction to it. You want to take big gasps, deep breaths, and the real aim is to get as calm as you possibly can and as fast as you can. And so even from the first minute that I sat down, it was pretty intense, but my body's already started to relax a little bit.
Can you ask Jeremiah how he's feeling right now?
How are you feeling? Jeremiah, how you feeling?
I'm feeling warm, actually. It's like a hot tub.
These are the mental exercises you have to go through. So, John, you said you find this place of calm, and you calm yourself down, and now obviously you're doing an interview with us, so it's a little bit of a different mental exercise for you. But what typically would you be doing at this point? Do you start to meditate, or how do you make your way through the couple of minutes you'll be in the water?
Yeah. Well, the biggest thing, even with meditation, is the recommendation is always focus on your breath. And if you follow your breath, that's a way to quiet your mind. And being in the cold water, truthfully, is one of the fastest ways into that state that I've ever tried. And it really is just about taking a full breath, relaxing as you breathe it out, and it really calms your whole body. And if you don't get calm, there's no way you can last in this water. It's too intense. And I don't know if you can hear behind me, there's some ice that's just jamming up. I can hear it kind of crackling behind me. So I think that's about it for what I'm going to do today. Just because we got kind of a walk back through the ice, I don't want to push it too much with my feet.
Yeah, no, get the hell out of there.
Okay.
Let's go.
Yeah.
So that was it. There's nothing like that. It feels intense in the moment, but there is such an uplifting vibrancy that comes into your life from doing this. So anybody who's watching and is thinking about it, I would say definitely give it a try.
I've got some friends that do it. I think every day, John Mark, or close to that, with an ice bath in a controlled scenario in their home. But they do ice baths every day, and they swear by the impact that it has on their mental and emotional well-being. Obviously, you push yourself to a point of great discomfort, though.
Yeah, it really is. And I was just reading something the other day that said, your real training doesn't begin until you feel like giving up. And there's a point in the water where, everything feels, well, obviously it feels intense, but it's bearable. And then it's such a mental exercise because you can feel the cold kind of increasing, and your mind is saying, okay, it's time to get out. It's time to get out. But it's always a balance between what you're willing to tolerate and that discomfort. So yeah, it's a really amazing opportunity to face yourself every single day.
John, I was expecting a team of people to run up to you and cover you in the shiny blankets and start rubbing your shoulders and your calves. But you're just chilling with your shirt off. You're chilling in shorts on the Peace River.
Well, yeah, I am. I'm standing by a fire.
Okay.
So that part's not too bad. My wife did come and give me a towel, which I have tucked under my arm here.
Look at your skin, though. Your skin is like this red. Obviously, it does something physical. A huge sort of has a huge physical impact there.
Yeah, it really does. And the more that I've done it, obviously, I've learned a little bit more about the physiological processes that get activated when you go into the cold. And your body has mechanisms to protect itself quite well. And part of that is when you go out into the cold, all of the blood vessels in your skin close tightly, and it stops the blood that's being cooled by the water or the air from circulating into your core. And you actually, just the way that our bodies are, have mechanisms to protect us from the cold. We just very rarely put ourselves into situations where they're needed to be used.
Journalist Trevor Robb is watching right now. He says, this is an extremely Canadian story. Edmonton City Councillor Tim Cartmel is watching right now. He says, not a chance. I'm with you, Councillor. People are suggesting that Sam Brooks and I should be doing this in the North Saskatchewan, and I'm going to just immediately kill that idea. That ain't happening. John Mark.
Yeah, I think you should.
I'd do a live hit from a hot spring, but not from a river in the winter.
Yeah, that's right.
Maybe that's what we could do. We could meet up at a hot spring somewhere and go into a cold pool.
Oh, buddy, if you want to do that, we could do a whole show from the pool. I'd be fine with that. Unbelievable.
That would be awesome.
Well, hey, listen, this is, I don't even know what to say to wrap this, except just you're an absolute legend, and your son Jeremiah as well. Can you talk to us for a second about your wife and the impact that she's had? Sam, maybe we could tee up some of those photos. My understanding is that the majority of the photos on your Instagram, which I encourage everybody to follow at John Mark Earle, are your wife's work, and she just has a beautiful eye. She's also out there with you all the time. What has this done for your relationship with your wife?
Well, not surprisingly, it has ups and downs, but because of the intensity of this whole experience, sometimes emotions are high, but she's here right now. She's actually holding the phone for me. And my sister, Bethany, she comes out a lot too. She has some of the photos that are on there also, but it's been a surprisingly unique opportunity for us to come out as a family and spend time in nature during the winter, doing an activity we never imagined we would be doing.
John.
And yeah, my wife has gone in too. And it's something that, although she doesn't go in as regularly as I do, it's been something that it really has brought us together.
Brenda's watching. She says we need to get this guy a Real Talk toque. I'll tell you what. The minute that we have Real Talk toques, you're getting the first. You're getting the first one, buddy. That would be unbelievable. Ronan is wondering if you peed in the river to warm up.
Definitely not. Honestly, they go in the river, everything tightens up so much. It's not as easy to just let that go as you think.
Yeah, just ask George Costanza, right?
Yeah.
John Mark, I'm so thrilled that you made this happen. There was a lot of effort that went in behind the scenes for you to scope out an area that would have good enough reception for you to stream video. You went out, you pounded out the ice ahead of time to clear the way. You got your son Jeremiah here. This is a segment. This is an interview I will never forget. Go warm up, my man. And I look forward to, hopefully, I'm imagining that your Instagram following is about to double. I hope that's the case, my man. Thanks for making time for us.
Thank you. I'll just say one last thing.
Yeah.
As I'm standing here talking to you, the back of my shorts is frozen solid. So that's how cold it is here today.
Okay.
Can you turn around and show us?
Yeah, show us. This is the first time we've ever asked a listener or a guest to do that. But yeah, look at that.
This here is just like
look at your
a frozen block.
Look at your skin, though. Your skin is like ruby red still. All right, buddy. Hey, go get a blanket around you. And I imagine Jeremiah's already back in that beautiful hunter-patterned bathrobe. Nice job, you two. And thanks for making time for us on Real Talk. That is the legendary John Mark Earle coming to us from Peace River. How are you? What did we just witness? What is going on? Sandra's like, go get dressed. Go warm up right now. Sandra, yeah, she's saying it's time to end the interview. You got to let him go. And that's right. I have a sense Jordy says he's my hero. That was very brave. I get the sense that John Mark Earle is one of those guys that finds comfort in the uncomfortable, but the mental fortitude that would require. Like you and I mean, the idea here, people are saying, well, you should do this in the North Saskatchewan. You and I, and the answer is an immediate no. Like,
I also think the North Saskatchewan's not safe for that, but that is a question for my friend Vince, actually, who I've been thinking about this whole thing. So my friend Dr. Vince McFarland, I'm going to give him the doctor because he earned his doctorate 2 years ago, now works out of the University of Winnipeg. He's originally from Edmonton. He is a river ice researcher.
Oh, wow.
So he actually has done a ton of field work in Peace River, except he puts on like full body thermal hip waders when he goes out into the river to take measurements because he specifically studies the way that ice forms during freeze up.
How fascinating is that?
It's really cool. Okay, can I nerd out for a moment here?
You can if you can keep it in less than 14 minutes.
Okay,
yes.
I can nerd out in 30 seconds. So Vince studies ice as it forms in turbulent water, and it forms as something called frazzle ice, which are these absolutely perfect little circular discs of ice. Which I'm trying to make it. My microphone's in the way of the camera. There we go. Anyways, point of these tiny little circular discs, and that's how ice forms in river, and then they clump together, and that's what you see floating down the river. They're called frazzle pans. And Vince uses imaging technology to measure the size of them. So like not only is he like quite literally a world expert on river ice, but he also, the images that he takes of these frazzle crystals floating in ice are stunningly beautiful.
Wow. Okay. Can you, while we have this next interview, hey, sorry, we're just going to have to move on to check in with an 8-time world champion boxer. So just, pardon us. I apologize that there's been no break on this show with boring garbage for us to be able to go top up our coffees. It's just nonstop fascinating interviews with wonderful guests. But maybe when I'm talking in a second to Jelena Mrdjenovich, maybe you could does your buddy have an Instagram?
I will see what I can
Could you maybe
find.
pull up some frazzle ice photos that maybe you could show us? That would be pretty cool. I love this. Greg, by the way, saying that Sam is really seems to be kind of on the comment thread. Greg says you're protecting the Hanson salted caramel. It does appear as though you're I noticed that I have a full coffee here that does not have any Hanson salted caramel in it, Sam, which is I don't know what to read into that. What I do know is that shortly after we mentioned it on the show, and Hanson's not paying us to do this. Actually, you know what? You dropped that bottle off. I'm going to go ahead and give her the credit for dropping it because she deserves it. It was a gift to Real Talk from Edmonton mayoral candidate Cheryl Watson. So there you have it. So that was probably the best $50 or $60 that Cheryl Watson's campaign team has ever spent. Thank you for that. But I did hear from many of you in the audience that said you went online to see about the availability of the Hanson salted caramel coffee liqueur immediately after we mentioned it, and it was already sold out. So apologies for that. But if I know anything about the team at Hanson Distillery, they're probably going to be getting that back in order, which is good because they owe us, as we mentioned, a case for talking about it on the show today. You see how we do this? Let's recognize a couple more of our sponsors before we get to 8-time world champion. She's defending her title tomorrow night. She wants to add another belt to what is already, as far as I'm concerned, a Canadian Sports Hall of Fame career, Jelena Mrdjenovich, in just a moment. But right now, we wanted to remind you how excited we are to be partnering with the team at Park Power. You know, they power our Real Talk RJ hashtag, which is where we keep, where we get a sense of how you feel about what's going on right now, the stories that we're covering, maybe the things that we're not talking about. DMAC or D-Man right now, DC and YEG says that was absolutely awesome. With John Mark Earle says, I don't even know what else to say. That was just awesome. And then he hashtags Real Talk RJ and Meanwhile in Alberta. I love that. D-Man, thanks for tuning in. Park Power, is your friendly local utilities provider. So that means they're in the natural gas game, they're in the electricity game, and they've got internet services as well. So you're paying someone for those services. Why not bring your business over to Park Power? They're local. Their call center's local. Their customer service is local. They're partners with Real Talk. And they profit share with local nonprofits, local charities. How cool is that? You can check out more at parkpower.ca, or you can look them up on seriously any social media platform. Their social media game's amazing. So whether it's LinkedIn or TikTok, Twitter, Instagram, Facebook, whatever's your jam, you'll find Park Power there. We're also really grateful to be teamed up with the team at Alta Moving and Storage. Now, as the name would suggest, they've got the long-term and the short-term storage. You need to get something out of the basement, or you're moving, or you're renovating your house and you need to get the furniture somewhere safe, climate controlled. They've got that covered. And then they also have those pod style containers. So you give them a call, you tell them exactly what you're doing, and then they'll help you find the perfect fit. They drop it off. They can provide movers to help you load and unload that pod style container, or you can do it yourself. And they have those frog boxes too, those eco-friendly moving boxes. Basically, the point is they've got you covered at Alta Moving and Storage. Do we have Jelena on the line? We asked her to check in about a few minutes from now, so she'd be early if she was on right now. Jelena Mrdjenovich down in Los Angeles, California, an 8-time world champion boxer out of Edmonton. You likely already know that, is going to be defending her title tomorrow night she's going to be fighting Paola Torres. It's the WBA featherweight belt. She's been a world champ in 3 different weight categories. She's an absolute legend, fighting out of Edmonton, Alberta, of course, but there's a real emotional significance, and we'll ask her about this. Her longtime trainer, Milan Lubovac, is currently on life support following a cardiac arrest coming up on a year ago, about 10 months ago, and Jelena, I know, is fighting for him, and we're looking forward to hearing that story. Sam, we do have a second here, so why don't we get to the news headlines, because there are a few stories that I think are demanding our attention, and we want to make sure that we pay attention to those. Here's what's going on in the world around us today. Sarah Kahie is the first Albertan to receive the COVID-19 vaccination. She is a respiratory therapist at the University of Alberta Hospital. She says that it felt like a historic moment. Said the respiratory therapist, Sarah Kahie, I feel honored and very grateful to be part of this entire experience. When I woke up, I wasn't expecting to be the first person in Alberta to get the injection. That's exactly what happened yesterday. Of course, we expected about 1,800 healthcare workers, most notably 2 hospitals in Calgary, 2 in Edmonton will be the first to receive that, as well as long-term care residents. And we'll keep you posted as vaccination opportunities arise, or as more news is available with regards to the public's schedule on that. In sad news, the search has been called off for a Winnipeg sailor missing from a Canadian Navy ship. Master Sailor Dwayne Earle, 47 years of age, is believed to have accidentally fallen aboard the HMCS Winnipeg early Monday, about 925 kilometers off the coast of California. Just last night, a 30-hour search was called off, National Defense confirming that Master Sailor Earle's body was not found. Says Rear Admiral Brian Santarpia, it's with a heavy heart that we announce we have concluded our active search for Master Sailor Earle. The decision was not taken lightly. However, after extensive coverage of the search area, we have not been able to locate him. Our thoughts with the sailors and the Canadian Navy personnel aboard that, and of course, outside as well, the men and women of the Canadian forces who will mourn this loss without a doubt. And finally, Conservative leader Erin O'Toole under fire for comments he made in addressing a group of young conservatives at Ryerson University in Toronto. What's interesting here is that the Conservative leader, the leader of Canada's official opposition, was asked by these students how they should respond when confronted by conversation around Canada's residential schools by young Liberals. And the Conservative leader suggested that the line should be that residential schools were originally created to provide education, but subsequently became horrible. The response is being described as tone-deaf and even racist by critics. We will have an ask-in with Conservative leader Erin O'Toole, and we hope that we'll be able to speak with him. This being described by Bill Kelly, a radio commentator at 900 CHML, as evidence of Mr. O'Toole's propensity for shooting himself in the foot. You can let me know what you think about that. I've already seen some comments on our YouTube thread. We'll get to some of those later on in the broadcast. And of course, you can always use the hashtag RealTalkRJ. So we're hanging tight for boxer Jelena Mrdjenovich, who coming up in 54 minutes will be weighing in for her fight tomorrow, defending her belt. Sam, just let me know when she's here. And in the meantime, I'm going to go ahead.
We don't have her yet.
Okay,
I'm waiting to see her. I've got some frazzle photos if you want to see them.
Oh, yes.
Yeah, I've
Nice,
been
quick
texting
work.
Vince quickly here. So
Nice.
yeah, we got
so
this.
he hang on. He sent you these already in the last 5 minutes?
Yeah, we've been chatting. It's been great.
Love it. Okay.
Yeah, it's good. So this is what ice in the river looks like as it forms.
Whoa.
Isn't that cool? He's actually won awards from science communication publications for these photos.
I know that this is not the direction you're expecting me to take this, but this also looks like drone footage of those floating plastic garbage islands in the ocean.
Little bit, hey?
It looks
Yeah.
like floating garbage off the coast of Indonesia, but it's not. This is ice forming.
This is ice forming. This is in a lab, but he
Wow.
recreates the same stuff in the North Saskatchewan River and in Peace River. Very cool stuff. His Instagram's not public, so I'm not going to divulge what it is, but yeah, Dr. Vince McFarlane.
No, but hang on a second. Just
Yeah.
because an Instagram account is private, that just means that people have to request to follow.
That's true. He
It
doesn't
doesn't-
post this stuff on it. It's mostly just him and his fiance and his dog and that kind of
Okay,
stuff that he
yeah,
posts
yeah,
on. So
nobody
he wants
needs
to
that.
keep it personal, and that's fine. We'll
Nobody
respect
needs
that.
That's the Instagram thing with a lot of people, right?
Yeah.
Like you follow somebody because you're expecting to see what you're hoping to see, and then it's just a bunch of photos of their baby, and you're like, oh, right? That's the thing with Instagram, isn't it? Yeah, that's word on the street anyway. I wanted to get to this. You can send us an email anytime by all you do is you go to talk@ryanjesperson.com. That's what you type. That email is going to go directly to Sam, directly to me, and the rest of our production team. There's no rest of the production team. It goes to Sam and me if you email us at talk@ryanjesperson.com, and that's exactly what Katie did yesterday. Katie was tuned in for our talk with Ann Castleman of the Walrus, and this was Ann's piece on affordable childcare in Canada resonated with a lot of you I know, and it prompted Katie to send this email. Katie said, I was really looking forward to hearing your show with regards to affordable childcare. She says, I'm curious how much the United Conservative government in Alberta has cut the affordable childcare program in Alberta. You remember there was that $25 a day pilot program that the NDP had put in, specifically which centers they decided to cut. Katie says, let me be clear. I think that everyone should have access to affordable childcare, but I think that the cuts that were made carelessly. Katie says, for example, 2 daycare centers in Calgary in an affluent suburb still have that $25 a day program intact right now. Well, many childcare or daycare centers in lower socioeconomic communities were cut. More specifically, it doesn't seem right that a family with a combined income of over $300,000 are still allowed to be part of the program, while families that truly need it are missing out. Katie said, I would have been curious to know if Heidi Bergstrom had any insight into this. Wasn't Heidi Bergstrom impressive yesterday? She's an accountant out of Camrose, Alberta. She joined us to talk about this petition that she started. She's calling for a universal
national child care program in Canada. And if you want to learn more about that, all you do, it's simple. You subscribe to our podcast. The interviews will be right there on your phone, your tablet already, or you can go to our YouTube channel. We encourage you to subscribe there as well. Ring the bell so you know when we're going live. Like yesterday, mid-afternoon, we went live with Dr. Stephen Duckett. You can watch the past shows, or of course, you can just check out my Twitter profile where I've linked to Heidi's petition if you want to take a look at that and sign it. Katie says, I've sent my thoughts in an email as opposed to a tweet because I want to maintain some anonymity. We're not using your last name, obviously. She says, I was worried that the family that I know with the combined annual income of over $300,000 that still has the $25 a day childcare, I was worried that might confuse my question about this as a statement. And it may be perceived that I don't support the affordable childcare program. I absolutely do. I just wish every family could have access to it. But if there's not universal access, there's got to be a different way to choose which families are allowed to participate. Katie makes a great point. The way I see it is that there's got to be one of two scenarios. You either make it based on income, where you would say families under a combined income of whatever it is, $100,000, wherever you set it, $90,000, $150,000, probably depends on the community you live, the cost of living. It would have to be a nuanced perspective where you would say, the families that are under this income threshold or that don't meet this income threshold would qualify for $25 a day or for completely subsidized, or however you have it, however you structure it. That's up to the lawmakers, not to us. Or you say it's universal. That's probably the easiest way to do it. It's more expensive, but you just say everybody qualifies. Kind of like the idea, well, this is a bit of a stretch, but kind of like the idea of a flat rate income tax. Everybody pays 10%, which, by the way, is what I would do if I was premier. 10% flat rate income tax and a GST or a provincial sales tax, harmonized sales tax. That's what I think the government should do. But I digress. We don't have time to get into that because we have an 8-time world champion boxer joining us live right now from Los Angeles. She needs no introduction, but that doesn't mean we're not going to give her an introduction. Ladies and gentlemen, Canada's all-time great fighter, Jelena Mrdjenovich. Thanks for making time for us, and welcome to Real Talk this morning.
Hi, I am so happy to be on here with you.
We are so happy to have you here. Now, I'm a little surprised that you agreed to talk to us because you are in the zone now. Tomorrow, you will be defending your title. You're going to be fighting, of course, we know your 53rd career bout, and you're going to be defending a belt. So where's your head at right now? If I understand correctly, you're about 45 minutes away from weighing in.
We are very close. I think 10:30, 10:45 is what we're told. So this is great. It's a good distraction. I've been, eating ice and trying not to drink water. So I'm on weight. I feel good. I'm just trying to stay busy. So this is great.
Jelena, how do you approach this fight, your 53rd career fight, and obviously a big one for you? How does this differ from other fights? I know that there's a real emotional element to this one.
Yeah. You know my story. I'll give you a quick recap for everybody who doesn't know. My longtime trainer of 19 years suffered a cardiac arrest February 18th. We were training to probably get ready for a fight in March, which obviously wouldn't have happened due to COVID. And my life got turned upside down. Him and I have over 18 years have become 19 years, sorry, very, very close. I always joke around and say he has 2 daughters, one older than I and one younger. And I always joke around and tell everybody I'm the son he always wanted but never had, because I do the boxing, I golf, I, help him out with kind of everything. And it's been hard. So, that started my year, and then COVID obviously is happening. I shouldn't say has happened, is happening. And I've been going through a lot of depression and anxiety and stress and the only thing I really know how to, not the only thing, but the only thing I know for a fact that gets me out of a rut is training for a fight and doing what I love to do, which is boxing. We've fortunately, with the bubble and the situation that they've had with fighting, There's been a lot of opportunities for network TV and a lot of opportunities for women's boxing. And we had a lot of offers. So kind of Mel and I had to talk about this. And I said, I'm not on a good path. And I need to do something. So finding a new trainer and having this fight was that thing, even though I've been through, my goodness, like every emotional roller coaster throughout this camp. That's what makes it different. It is my first fight without Milan.
How do you think that that's going to, first of all, can I just say thank you for your honesty and thank you for your candor? And we named this show Real Talk for a reason, because these are the conversations we want to have. And hearing someone like you, a decorated fighter, a legendary athlete, one who will go down in Canadian history as one of the all-time great Canadian athletes, to hear you talk about your personal struggles and your low points and depression and the impact of this pandemic on you. And we haven't even talked yet about the fact that you're a business owner. You own Champs Boxing Studio, and I can't imagine what that's been like as an entrepreneur as well. But I so respect you for what you're bringing to the table here. How do you think that all of this, I know that fighters, you probably have to separate yourself. You probably have to, you go into a mental space in the ring where you can't become angry or you can't become exasperated. You have to be a tactician. So how will you be fighting this fight differently against Paola Torres, all things considered?
Well, that's the thing. I found an amazing trainer to finish my legacy with me, and someone who I found cares a lot about me in a short period of time as well. So I've been very fortunate, and I don't know if that has something to do with Milan helping me along the way or teaching me the right things and guiding me. But mentally, you say that separation, and yes, you train for what you're doing. But what I didn't realize, and I'm sure I did subconsciously, but I never had to think about it because he's always been with me. But what I didn't realize was how much Milan played into the last 10 days of training, and how much I relied on him and our relationship and friendship to get through the hard stuff. And so this has been a challenge. I've had a million breakdowns, and Jonathan's been amazing. He has pushed me to be able to, I didn't realize at the time, but push me to where I would be at extremes, and I would be exhausted physically. I would be exhausted emotionally. Unfortunately, he's not at this fight, but I have an amazing second trainer, Rick Phillips. And, through it all, I've had some natural hiccups, and I had a little fit, and I did see that rage. I had the sobbing tears in the middle of sparring. And what we did realize throughout all of that, and throughout that perseverance and endurance and pushing to the next level, was no matter what, when push comes to shove, Milan has taught me so well, and that I will come to fight. I was telling this funny story. My last sparring, second last sparring, because I had a hissy fit, but my last sparring was supposed to be Thursday, and I had a full-on breakdown round 8, and I was oversensitive, and some instruction I got I didn't agree with, and I melted down. And in between my tears, and I was like, start the bell. We had 2 more rounds to finish. And I went out, and I had this 150-pound sparring partner. He was amazing, from Miami, 108 Muay Thai boxing fights combined. And I went out, and I boom, 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 and I dropped him in the 9th round. And then I got up, and I was like, let's go. Gave him a second and did it again. And so I boxed so amazingly those last 2 rounds, and then continued that on the Friday for another 6 rounds. And so, what I did learn through that, and what I did realize with Jonathan and Rick pushing me, is that they were trying to get me to that point where I would break and see what I would do. And, when push comes to shove, when I have to face that extreme adversity, I will show up. I've been trained to do this. This is my 53rd fight. I've had 8 world titles, more than half of them title defenses. So, I just have to get my job done.
So basically, you go in there, and I don't know if I would imagine you approach different fights with different fighters differently. It sounds to me like you might just be looking for an early knockout this fight. Is that your strategy every time?
You guys have talked to me about this before. I don't like leaving it to the judges. I haven't had a lot of friends in the judging situation. However, this fight is so much more than Paola Torres. And I know that she is going to come amazing. She's going to come 150%. Everybody elevates to fight me. That target's on my back at all times. But I am just trying to get through this mentally and emotionally safe. And that will be the challenge. I know my first 2 rounds are going to suck. I'm going to have to settle in. I'm going to have to get over that. I was saying I watched promo clips. I was sending them off, and I didn't even watch the clip. I was watching the seconds before the fight, and when they do that intro, and I had a breakdown. Those moments before they say my name, before we touch gloves, before that bell rings, that is what I'll miss the most. And those are the times that I don't think I realized were so special and so important to me. So I think it'll take me a minute to shake it off, settle in, and then, I think once this fight gets dripping and the punches keep landing, I think I'll get the job done.
No, I have my own prediction for this, how this fight's going to go, but I'm not going to say. I'm going to let the fight play out. And we're going to be watching, Jelena, and we're going to be cheering for you, and we're going to be so proud. I want to revisit something. You've made a couple of comments. Have you confirmed? Is this undoubtedly your final fight?
No.
Okay.
This is just to see if I can continue to do this. I knew it was going to be hard. I knew the process was going to take me to every level. But I needed to see that when the 8 weeks come through and we're ready to fight, that if I can do that. And we are so close to finishing that. This weigh-in weight cut obviously was great because I'm talking to you. And this is the strongest, the leanest I have ever felt. So we just have to get the job done Thursday. And then, then they want to lead us into a unification fight. My goal is to be undisputed at 126, which means I'm missing 2 belts. So the goal is to get there, but one day at a time, one fight at a time. Right now, Jonathan and I are finding a groove and finding that relationship. And I do believe he is my guy to finish my legacy with me. But we'll see. I mean, Thursday is a big night, and Paola's coming to fight, and it's under the lights. So, I mean, we'll see what happens. Some people shine, and thus far, I've shone every time I've come out, most times. But you never know fight night.
Yeah, I mean, 8 world titles. You find a way to shine. I was going to say, I love how you're very open. You're very transparent on your social media. People can follow you on Instagram at Jelena Boxing. You look like this kind of a weird thing to say, I guess, in a way, but you look lean. You look like I don't know. You're jacked right now. You're rocking the 8-pack. You're you look.
I'll give you a little sneak peek.
Yeah,
very.
That's what we're talking about.
I'm pretty lean right now.
Yeah, so you're like
and
this,
and I feel great. I have a lot of energy. We made weight when I woke up, which is for me, usually I have to do a little bit in the morning, but that's why I said to you, I'm like, I can't confirm today because I might have to go to work.
Yeah.
And I woke up and I was on weight. So that's amazing.
Can you give us a sense of how would it have gone, Jelena, if you were like a pound or 2 or 3 heavy and you needed to make weight? How would you do it? What would be is it like diuretics, or do you wear a garbage bag, or how do you do it?
Yes, I put a sauna suit on. Boxer has the most amazing sauna suits, but I put a sauna suit on, and this is the way I like to do it. Some people would do a bath and go under blankets and sweat it out, but I put a sauna suit on and I hit the treadmill, and it's very light, very slow, just get that sweat going, about 20 minutes. And then I just lay literally under blankets, in sweatpants, and just keep sweating that extra half pound. So 1 pound is easy. If you're talking like 2, 3, you got a lot of work to do in the morning.
Okay. Because I was hoping you could maybe help me lose like 30 pounds in time for the holiday photos, but probably not, hey?
Well, do you know, actually, I mean, I don't suggest it long term, but pulling your sodium from your diet, or limiting your sodium, it works wonders. And that's another trick of the trade, is you take your sodium out, your food tastes like really bland, but and you will start just shedding water weight. Your body does some super incredible things, and just little fine-tuning things that I've learned along the way with a great team. Bite Me Meal Prep has been amazing. I had a friend, Mitch Clark, fought in the UFC, has helped me. Now Chris Camacho, who's been working with Triple G, and Nayla, has done my meal prep down here. Like, I've had some pretty amazing people help me out, and I've just taken tidbits here and there to make this process so much easier.
Mitch Clark is such a legend. Hey, it was like about 10 years ago that I, as a publicity stunt, I got in the octagon with Ryan Real Deal Ford, who just basically kicked the shit out of me for like 10 straight minutes. But Mitch Clark trained me for that, and along with Luke at Hayabusa and all those guys. When you take a look at Alberta and boxing and mixed martial arts, there's been a really tight community. I would imagine that you probably feel that support. Do you feel like, you're down in Los Angeles, you're going to be fighting under the lights? I should let people know that they can watch on NBC Sports. They can watch on the app Twitch. You can set up an account and do that. Search for Ring City USA. You can watch it there.
Yes.
And of course, make sure that you tag Champs Boxing Yeg if you're watching and chiming in. Do you feel when you're down stateside, or, I mean, you fought all over the place, do you feel like you have a bit of an army behind you now?
Yes, yeah, for sure. I mean, I am this, like you've said, I've been very candid. Part of the reason is because mental health right now is something that is, I think we're coming into the pinnacle of it. In Alberta, that it's getting really cold, and we're not able to get that vitamin D sunshine. We're not able to get out and get that fresh air because it is getting cold. And I fear that people's mental health is going to struggle. I have been going through it. And it is a hard thing to get out of that rut. And so why I've been so open is, if I can be an inspiration, a light, a catalyst, or something to say, hey, all you have to do is set your mind to something, and slowly every day get to that goal. This didn't happen overnight. I didn't get these abs overnight. This has been 8 weeks of keeping my head down, getting my job done, and going through the process. Yeah, it was hard. It was so hard. But throughout all of that, I mean, regardless of what happens on Thursday, I will have achieved something, because I have gone through the process. I have opened wounds to start healing them, to start closing them, and to start changing. And that is a big thing. That change, it doesn't happen overnight. It happens over time with incredible support. And I am very lucky that I've had girlfriends, a couple of my good girlfriends, my cohort, Carmen, Cheyenne, Lindsay, never mind my amazing sisters. And I have a book club, which is wine club, but right now it's soda club for me.
Yeah, that's right.
That we Zoom, and I got on a Zoom call on Friday with my girlfriends and all the people I grew up with, and it's times like that where you see like your people come, and they come together, and they're there for you no matter what. And without those people, being away for 8 weeks, isolated with my head down, yes, it's been a challenge. But without them, I don't know if it would have been as seamless. I mean, I did have a few hissy fits. I did have a lot of tears, more tears than I care to admit. But I also feel like I'm coming out strong. I'm coming out safe so far. And I'm going to come out ahead. And again, if I can help someone who's going through something shitty, who's going through something tough. If I can help one person, I just want them to know all you need to do is start. All you need to do is start the process and things will happen.
We're getting a ton of comments. I'm getting them on Twitter and on YouTube right now as well. I don't have time to read them all, Jelena, but April says Jelena is an extended part of the Edmonton Klansmen Rugby Club, and all of us are wishing her all the best. Greg says
those are my brother's people. Those are my family extended.
Yeah,
this is where we say.
Yeah, hey, well, if you're a fighter and you got the Klansmen Rugby Club in your corner, you're doing all right. Greg says she always speaks from the heart. She will rock again. Trevor says she's an absolute legend. And then a bunch of people are just writing, like Zed just says, damn. So I think that's a pretty good compliment as well. Hey, Jelena, I know you've got to go to your weigh-in, but let me just ask you really quickly, because we touched on this. You have a beautiful facility. The design of it's amazing. The rollout has been incredible. Obviously, you got kicked in the teeth like everybody else with COVID. Shortly after you opened Champs Boxing Studio, just north of Jasper Ave on 109th Street in Edmonton. What has the pandemic done, just to talk business for a second, what's it done to, obviously fitness studios have been hit really hard. How have you managed that?
Oh, I mean, I have a really good manager right now, and I'm thankful for her because she's the reason why I was able to leave. Cheryl has been incredible, and then we rolled out some virtual classes, but we'll be lucky if we come out of this kicking. I mean, if we continue, I mean, we're on a 4-week lockdown right now. I've been in hiding, and it's a struggle. It's stressful. I was supposed to open south. We were in the process of expanding, and that kind of kicked me in the face. So took a little bit of my nest egg away. So I'm a little stressed. My landlord hasn't been amazing. He's trying, but the owners of the building don't understand. They're not from Edmonton. They're from Vancouver, so they're not feeling it as tough as much as we are. I mean, everybody's feeling everything, but it's been an added stress. So hopefully we come out alive, and hopefully we are able to keep kicking after. But only time will tell. If we continue this way as an economy, I don't see how we're going to survive. You know, my family's in the hospitality industry. A lot of my friends are in the entertainment industry, and we're going through that mental stress, that mental health. Like, that's why I keep talking about it. I was going through this since February, but everything accumulating, I was not on a great path. And I see kind of where I was, and I see a lot of my friends who own businesses, who are, you know, entrepreneurs struggling, and it's hard. I mean, our community is trying to support, but our government isn't helping us. So they're helping as much as they can, but I just would like to go back to real life.
Yeah, no kidding. Hey, listen, let's end on a positive. I want to read some more of these comments. Like Two Beavers listening in and just says, what a powerful spirit. Sarah says, what a candid and poignant conversation with Jelena this morning, showing true strength. She says, good luck in your match tomorrow. I will be rooting for you. Alicia's watching from Calgary. She just says, you got this, champ. So we're all going to be cheering for you. Andre's wondering how he can watch. I'm going to let everybody know all the details, Jelena. We're going to let you go get mentally prepared and go weigh in, and we'll be following with great interest, and you'll probably be able to hear us from here in Alberta in Western Canada. We got your back, champ. Go get him.
I hope so. I also want to say I am super proud of you for this podcast, and I am so thankful you finally got me on.
Hey, well, it took me 3 weeks. What the hell was I don't know why I made you wait so long.
Well, I know. I thought I would be your number one call.
Yeah, well, hey, you'd be any other time, my friend. You were in training. You were in your bubble. You were training. We're following the story, though. Yeah. Hey, Jelena, go get him, and I can't wait for the next time our paths cross.
You guys, thank you so much from the bottom of my heart. This truly means a lot. The support that everybody has given me has been overwhelming, and I do it for everybody at home.
Yeah.
Thank you.
You got it. I love you. Amazing. What a fighter. That's Jelena Mrdjenovich, 8-time world champion. How do you not love her, right? Like, she's absolutely incredible. She's going to be fighting, as mentioned, tomorrow. The best thing you can do is go follow her on Instagram at Jelena Boxing. But if you want the details on how you can watch, so it's December 17th. That's tomorrow, 7 o'clock. She's fighting in Los Angeles. You can watch NBC Sports is going to be carrying the fight, as well as the Twitch app. So you can download Twitch and then you just set up an account there. You can also search for Ring City USA. Just Google Ring City USA, and under their schedule for December 17th, you'll be able to find it there. You'll be able to choose the fight and then watch on your device, or you can actually stream it to your TV by way of Ring City USA. So all the details, though, again, her team is doing a really good job. She's obviously got somebody managing her social media while she's training for the fight. They're doing a good job of making that accessible. Jelena is just, there's not even a point to this story, but I just want to say, like, it was kind of funny. She was talking about Milan, her longtime trainer, Lubovac, who's suffered that cardiac arrest back in February and has been on, quite frankly, has been on life support since. And you can tell, obviously, that Jelena will be fighting for him. She talked about how she was kind of hit the son that he never had. And when she said that, I got this memory, and there's no real point to this story. I just want to say how much I adore her. You know probably that I'm the in-game host for the Edmonton Oilers, and I can't wait to get back to that. It means that I'm the loudmouth on the Jumbotron when the Oilers are playing at Rogers Place, and it gives me a chance to obviously head into some of the suites and to rub shoulders with some people and meet people and spend some time talking. And I walk into this luxury box last season at the invitation of the host, and they said, "We've got some people here. We'd love for you to meet them, make them feel welcome." I said, "Yeah, that's what I do. It's my gig." I walk in, and there's Jelena Mrdjenovich, 8-time world champion boxer, and Canadian country music legend Gord Bamford, and they are getting into one, and they are having they're nobody in this luxury box is having a bad time. And so I'm watching, and I have other responsibilities. Like, I have to go out and I have to like do my job and talk to people and be professional. And so I was like, "Hey guys, like, I got to come back. I cannot engage in this fun, this frivolous fun. I have a job to do." And I said, "Are you going?" They said, "We're not going anywhere." So I complete my obligations, I complete my duties, and then I ended up heading out with these two, and we painted the town. And we painted the town until the wee morning hours. And I will never forget the interaction, seeing it was kind of funny because I was the guy, there's the three of us out, and people would come up and say, like, "Can we get a picture?" And everyone's like, "Yeah, you can get a picture, right?" And people just hand me the phone. Like, "You take the picture." Because we want a picture with Jelena Mrdjenovich, 8-time world champion boxer, and Canadian country music legend Gord Bamford. And it was one of the greatest nights. Two of the great Albertans with a huge heart for people, a huge awareness of their fan base, and a real appreciation of their fan base. And I can tell you, and you can see it there, I think with every word that she delivered, how aware she is of the support that she's receiving and how much it means to her. So she will be fighting the 53rd fight of her career. It's tomorrow night. She's going to be taking on who I think she is indicating she sees as a formidable challenger in Paola Torres as she defends her belt. This is, again, a big fight. She's defending her WBA featherweight belt. The fight, again, in Los Angeles, California. What an absolute legend. Before we sign off today, we wanted to remind you that our question of the week is available at ryanjesperson.com. You just go to the home page. You'll see it right there in the top corner, the question of the week. That's put out every week by our partners at Y Station. They're the official research and strategy sponsor of Real Talk. And this is your chance to have your voice heard on Real Talk. I mean, let's be honest, there are a lot of chances for you to have your voice heard on Real Talk. That's the whole point of the show. But this is how we find out where you're landing on issues in the news, on topical scenarios. And right now, the question of the week this week, we want to know how your holiday shopping routine has been changed or impacted due to COVID-19. We'll get to the results next Monday on the show. That's how we're going to do it each and every time. And then we'll roll out our new question of the week next Monday. Right now, we encourage you to go and sign up and become part of our Real Talk Y Station panel. We've already got about 400 people signed up. We wanted that number to be 3,000. So then when we go to polling, like, we're going to have unique polling, scientific polling specific to this show. How cool is that? Not we're going to have, we already have it, but we want to make sure that our sample size is nice and deep. So we want 2,000 to 3,000 people as part of that Real Talk panel, and you can sign up today. It's obviously free. That goes without saying, and we value your perspective. So that's a wrap on this Wednesday morning. We're back at it tomorrow. We have a great show in store and a special surprise coming up on Friday. You're not going to want to miss that broadcast. Thanks for tuning in. Thanks for sharing the podcast. And we'll talk to you again tomorrow at 8:30 Mountain Time at ryanjesperson.com.
They're gonna